Welcome to Ask Me Anything, the live edition today. We're going to talk about skin care and skin cancer, and who better to answer those questions than Zakia Rahman, Dr. Zakia Rahman, clinical professor of dermatology here at Stanford Medicine. So let's start off with skin cancer. The cases of melanoma, are they increasing or decreasing?
Thank you so much, Lisa. I'm super excited to be here and to share the knowledge that we have that I share with my patients and also our trainees to people who may not have access to it before. So it turns out that skin cancer is actually the most common type of skin cancer that any of us have in the United States. So that's the bad news. The rates of skin cancer are also increasing. So over about a 10-year period, the rates of melanoma actually increased by about 27%. But the good news is that the rates of death from skin cancer are actually decreasing. So I think skin cancer is like an example of how early screening and prevention and treatment really can change the trajectory of cancers.
Let's talk about prevention. You always hear slather on the sunscreen, yet there's some pros and cons apparently out there about using sunscreen, the chemicals involved.
Yes. That's a great topic, and if any of you guys are Star Wars fans, which I think some of us here are, may the 4th be with you. But also, if any of you guys have watched The Mandalorian, as a dermatologist, I'm not advocating for living in a cave or always having your face covered. This is not the way. There would be no life on Earth without the sun. The sun is really important. I love being in the sun. We just have to find kind of nice, important, ways that we can actually advocate for ourselves and our patients to be able to be sun protected. So I think that there's pros and cons, and there's easy things that we can chat about if you want to go into
Sure, give us a routine.
Yes.
So that we leave the house with sunscreen on.
Yeah. So the way that sunscreen works is it's actually not linear. So it's not that an SPF 15 has half the protection of an SPF 30. It's actually logarithmic. So if you look at an SPF 15, that has about 94% protection against the sun's harmful rays. If you go to SPF 30, that's only up to 98%. So it's not that a higher SPF, which is the number that we see in sunscreens or sunblocks, is necessarily better. Sometimes it actually makes it really intolerable. But what happens is most of the time we put about 1/3 of the amount we need to get to that number. So we end up getting a much lower number than the SPF sets. And oftentimes because it's really greasy.
Right.
So the first thing is whatever's tolerable, and then 2 is if you can wear at least an SPF 30 because you're probably getting about an SPF 15.
I think I have the misconception that when I go to the store and buy sunscreen of 50, 75, so I'll be that much more protected. You're saying if it's 30, that's still good.
Absolutely, yeah, and I think that the FDA definitely wanted consumers to be aware of this too, that it's not like you can slather on, or if you should always go for the higher SPF number. That's not necessarily always better, and may just be something that may not be tolerable. That higher number is something that you can wear longer, so you don't have to reapply, but unless you're out there really sweating, you don't have to really reapply throughout the day.
Well, this being Skin Cancer Awareness Month, this advice is great. But for some, they cannot stand the chemicals in sunscreen. So what do you do then?
Yeah, I think it is really important to find whatever it is that you can fit into your daily life. I always like to start with sun protective clothing. So topical ingredients have SPF, but the clothing ingredient version is called UPF. So ultraviolet light protective factor. And oftentimes you can see clothing that has that UPF rating. And you can get those really anywhere. You can get them even online, at stores like Target, Costco, other places. So you look for that UPF. Now there are clothes that don't have that UPF rating, like in the winter if we wear a nice thick sweater, that's got a good amount of protection. But if we were just to have, say, like a white t-shirt that's been washed a lot, that'll only have a UPF of about 3, which is not that much. So clothing, I actually wear driving gloves whenever I'm driving, and it's something I picked up when I first went to Japan, and I thought, this is amazing.
Because of the sunspots that you get on your hand.
Yeah.
You just don't realize it.
Exactly. And then really you don't want to goop something up that's going to be on the steering wheel. It also turns out in the United States, windshields are all required to have UVA protection. So here we are looking out in this beautiful Bay Area view, but ultraviolet light A penetrates through window pane. And it turns out that our side mirrors don't have UVA protection. So we do know that people are more likely to actually get skin cancer on the left side of their face in the United States. So you can actually get these tinted. A lot of our patients who have a history of skin cancer, I'll write them tint letters. So that's something you could consider. So sun protective clothing. And then the parts that are exposed, you can use either a sunscreen, which is a chemical blocker, so it absorbs ultraviolet light and converts it to heat, or a sunblock, which is a physical blocker.
So we're talking about skin cancer, but we're also talking about skin care. You put on the sunscreen to ward off skin cancer, but also we have a ritual about using retinoids to not only protect you from the sun, but also to give you more of that youthful glow. Let's talk about retinoids, the pros and cons of that.
Happy to talk about retinoids, personal favorite of mine and probably a lot of dermatologists that I know. So retinoids are actually compounds that don't naturally occur in our body, but we can get them naturally in our food. So I know we were talking a little bit earlier about what are the foods that give retinoids, and so it turns out like beta carotene and other foods like carrots, broccoli, winter squash, they actually have a lot of beta carotene. And it turns out that those carotenoids are good for us. There was a really interesting study published in the Journal of Psychology in 2014 that took people's pictures, and they had faces that had more carotenoid. So they looked like people who'd been eating a lot of carrots and squash. And it turned out that people who didn't, independent reviewers found that the carotenoid faces looked not only more youthful, but more attractive. So, our skin is, people don't look at people and see their heart and see how healthy they are, but we see people's skin, and it turns out what's good for us on the inside makes us look more attractive on the outside.
So you're eating these foods that are healthy for you, and these foods can actually make you look younger. So you're saying load up on the broccoli, the squash, the carrots, and it's cheaper too, right?
Yeah, I mean, eating shockingly healthy, good food that is simple and it's not highly prepared is good for us in many ways, and great for our skin when we can kind of chat a little bit more about acne and some of the things that can cause people to have acne. But in addition to that, there are actually topical retinoids that we can apply. So there's over-the-counter retinols, which are like a weaker version. There's actually retinoids available over the counter now. So adapalene 0.1% is FDA approved for acne. And then you can get prescription strength from your dermatologist or other physicians who can prescribe it.
What about the side effect of flakiness from the retinol, the retinoids?
Yeah, so that's sort of one of the benefits. So these retinoids get absorbed into the cells, and they actually work in the nucleus of our cells. And so they increase turnover. And initially what we see is that we see like a lot of flaking, but it turns out that if you continue to use retinoids, sort of those negative side effects wear off, but the positive effects remain. So just kind of, I kind of hold people's hands while they're going through it. There are things that you can do to help moisturize your skin while you're on that process, but really that weans over time.
So you have to exercise some patience when you use those retinoids, the retinol.
Yes, absolutely. And I'm guilty of not being patient with that, but yeah.
None of us are.
Yes.
So let's talk about over-the-counter and prescription. Differences, is one better than the other?
Yeah. So a lot of the over-the-counter, sort of the cosmeceuticals, which are technically not supposed to have a biological effect, but they do, are the weakest. So they take longer to have that effect, that beneficial effect. But they can be more tolerable. So if you really want to start out, if you have really sensitive skin, start out with something that is an over-the-counter. But most of us can even start off with something like an adapalene. So that is a retinoid, kind of in the same class of products. And then if you want, you can go up to a prescription strength, like something like a tretinoin or adapalene 0.3% or even a tazarotene.
Well, I have to make a confession here. You gave me that advice like a couple of months ago, so I started using adapalene, right? So I feel a difference in my skin Do you see a difference too? I don't know.
Well, Lisa, I think you have really beautiful skin to begin with. But yeah, I think that, so there's a few things that we see. We see actually normalization of pigmentation. So it's like the areas that are hyperpigmented kind of normalized to our normal pigmentation. We actually have a reduction in acne. And acne is something we're seeing well into adulthood. It used to be a disease of teenagers, but now acne, we have during our entire adult life. So that happens. We also see compaction of the very top layer of our skin, the stratum corneum. So our skin is brighter. It reflects light better. It also actually reduces these things called collagenases, which actually break down our collagen, it's kind of the scaffolding in our skin. So we have collagen and then we have elastic fibers. So all of these kind of give our skin a nice bounce. It makes it look firm. And so with retinoids, you actually reduce the breakdown of that collagen, you increase new collagen, and you actually increase new elastic fibers by kind of creating that fibrillin, which is a scaffold for that to be built on.
Let's talk about, related to that, one size does not fit all. You have different skincare routines for the more youthful and then the more mature audience. So give us tips for both.
Yeah, I think that it is really important to have a personalized regimen. And so certainly when we see patients, we can kind of look at their skin. Oftentimes when people are very young, their skin tends to be more oily. We know that retinoids work on sebocytes, which are the oil-producing glands. So sometimes it can really help when people's skin is really, really oily. And I think patients whose skin gets a little bit drier, there's obviously advantages of that. But one of the disadvantages, our skin can get more sensitive. But over time, we can actually hydrate our skin, and there are things that we can apply on our skin with our retinoid regimen to prevent our skin from becoming too dry.
Say for the over 40 crowd, what would you advise that group of people in terms of taking care of their skin?
Yeah, sun protection I think is the most critical part, and even getting back to skin cancer, we use a little trick with our patients, we dermatologists. People are more motivated to use sun protection for prevention of premature aging than skin cancer. So it turns out that is the number one thing that you can do to prevent premature aging of your skin. Using a gentle cleanser, so cleansing your skin about twice a day, and then applying a moisturizer. I really like the over-the-counter hyaluronic acid. So hyaluronic acid is something we have in our skin, and temporarily we can apply it and moistens our skin. There's also topical products that have dimethicone. A lot of high-quality hair care products have that too. So it's sort of like a sealant on top of our skin. So it's a layering, like a cake layering effect. And then we can add the retinoid on top of that at night. In the morning, we can add a vitamin C, which is a potent antioxidant. And then the last thing that you apply is your sunscreen.
Oh, okay. All right, that sounds good. So I'm not going to pronounce the name right, but it's
Spironolactone.
Okay.
Yeah, spironolactone. And so I think there was a question that we had on Instagram Live, can you continue to use spironolactone for a long time? And a lot of our patients who have acne, and again, acne well into adulthood, we can kind of go into that a little bit later about what's happening in our environment that's causing people to have acne and a lot of these endocrine disruptors that we have. But spironolactone is something that's often, it's a medication that's actually a diuretic, but it does have some hormonal effects, and it's something that we commonly use for treatment of a variety of conditions, including acne and hypertrichosis. People have polycystic ovarian syndrome. It is a medication that, especially when monitored, is safe to use for the long term. But again, under the advice and treatment with your physician.
Let's talk about also, when we talk about environmental health, a lot of people are suffering from allergies, and that has an effect on your skin. Can you talk about that?
Yeah, absolutely. We've been really lucky in Northern California to have had a lot of rain, but again, there's a lot of pollen in the air, so a lot of people have these kind of natural allergens. We also have these sort of xeno compounds that we're exposed to. What happens naturally when we have hay fever, asthma, or eczema,
we have watery eyes and runny nose, and oftentimes people are kind of sniffling. So you'll get a line on your nose that is a telltale sign that you have allergy. There's also something called an allergic shiner, which sort of you get kind of like this dark eye look underneath, and a lot of young people have it, and they're like, oh my goodness, my young child has it. Yes.
Yeah. And that's all from the allergies and
it is,
environmental circumstances?
Yeah.
And how do you attack that? I mean, can you attack that?
You can. There's some really incredible medications that specifically target the overreactive immune system that people have for allergies, but over-the-counter antihistamines also work quite well. So I think, start there.
What's also been in the news lately is Ozempic, right? And the dramatic changes, not on just your body, but also your face. And you had talked about earlier Ozempic face.
Yes.
What is that?
Yeah, so we see that these medications, which are these glucagon-1 agonists, so they are medications that are, these hormones in our gut that our body naturally produce after we eat that make us feel full, that make us less hungry, and these are medications that were initially approved for diabetes and now are getting approval for weight loss and are really all the craze. And one of the things that I think we are seeing from Ozempic is people are losing fat. But one of the things that we learned from the early days of actually the HIV epidemic is not only the HIV infection, but the treatments for it kind of show us what happens to fat cells as we age. So our fat cells are in two different compartments. There's the visceral fat, which gives us our big belly, or something called the buffalo hump. And so that's our visceral fat, kind of like the bad fat. And then we have the subcutaneous fat, which is this fat that makes little babies' cheeks look really full, right? That make our faces look full, that give our back ends fullness, that can actually make our limbs look attractive. And so what happens is through aging and through things like rapid weight loss, we actually get this accelerated aging of fat. And a lot of that is mitochondrial toxicity. So this is like the powerhouse of our cells. And so what happens is we get lipohypertrophy or growth of this visceral fat, so the bad fat, right? So as we get a little bit older, we can kind of see a little bit of that belly, and then we get lipoatrophy of the subcutaneous fat, the fat that makes us look attractive, kind of the good fat. And we see this accelerated with people if they're on these medications and they have a rapid weight loss. They lose that subcutaneous fat first.
So you look gaunt.
Absolutely, yeah. So, anytime we have sort of this like rapid weight loss and weight gain, and we do see that once you stop these meds, people gain that weight back, then you're going through that yo-yo process where the first fat that you lose is the subcutaneous, then your bad visceral fat, but when you gain it back, you gain that visceral fat. So I think there's healthier ways. I mean, there's certainly people who are appropriate for these treatments, but that's what we're seeing with that Ozempic face, that subcutaneous fat loss that makes people look really gaunt.
Another question from our viewers, our Instagram audience, is about parabens and if they're harmful.
Yeah, I think so. A lot of people have these questions, particularly around sunscreens and sunblocks, and we are seeing more and more data, particularly looking at things like sperm counts and sperm vitality, which is a major issue in fertility, particularly for men. So these are things that disrupt our endocrine system. So we have this really delicately balanced endocrine system in our body. And things like BPA or parabens or other things can disrupt that. It is really almost impossible to avoid these, right? We see these like microplastics are even now found in human blood. When we turn on the tap water, right? Like it's almost impossible to avoid it, but we can avoid those in our ingredients. And so oftentimes what I'm recommending is using physical blockers with titanium or zinc oxide. So those overall can have a lower effect and are safer to use if that is an area of concern. So use sunblocks, and particularly for young children as well.
Are there any other ingredients to avoid?
There are a number of different ingredients in sunscreens, and with a lot of products, right, there's like a list of 50 ingredients. So ingredients that are really overall quite simple. Sometimes people can actually look through or can do a search for products that don't have that.
if people are allergic to those, you can actually get patch testing done by a dermatologist to see what it is that you may be allergic to or sensitive to.
Okay. And another question is also, how important is it for those who are pregnant to take care of their skin?
It's important to take care of your skin anytime. I think that there are some positive effects that happen during pregnancy, right? Especially during the second trimester, where people see this pregnancy glow. There are certain things that we can't use during pregnancy, retinoids being one of them. So important. Don't use those if you're pregnant, and oftentimes, you don't want to use those early on in the pregnancy. I think good sun protection is important. This is an opportunity to continue eating all of those really healthy foods.
Broccoli, carrots, squash. Write all those down.
Exactly. Yes. We'll be eating those later.
Yeah.
Sure. And there are medications that are safe to use during pregnancy. So oftentimes pregnant patients will have acne flares or rosacea flares. And there are medications that are safe to use during pregnancy. So again, talk to your physician and have them prescribe things that are safe to use during pregnancy.
I'm curious, from the patients that you see in general, what are the problems, the most visible and common problems for people who come to see you with some kind of skin affliction?
Yeah. Well, as my bracelet tells, and some of the lasers in the back, my area of passion and expertise is lasers. And so we see a lot of patients who have conditions that we can essentially use light to have beneficial effects in the skin. I see a lot of patients who have pigmentary disorders like hyperpigmentation, either from inflammation like acne, people who have conditions like melasma, people obviously who want to prevent premature aging of their skin or to treat volume loss that they have, whether it's from medications or just natural aging.
Do these conditions get worse as you get older?
So there's so much variability in that. And so, we can go on this fairly long, interesting discussion about the science of longevity. And my colleagues who co-direct the Stanford Center on Longevity, Laura Karstensen and Deb Cotto, so they talked about how human lifespan doubled in the 100 years between 1900 and 2000. And so this extra 30 years, there's all kinds of implications to society for this. But as people have these extra 30 years, they really want to sort of maximize their biological age. I see patients all the time in their 70s, 80s, and 90s who are living really active lives, who look great, and they may actually be more active and healthy than younger patients in their 30s, 40s, and 50s. So there's a lot of variability. There's genetic variability, but also the way we live and what we're exposed to. There's a new branch of science called omics. So our DNA, RNA, and our proteins, so the epigenome, which is really influenced by how we live. And so our DNA can change and we can produce different proteins based on what we eat and the environment that we're exposed to.
Right now we're in an environment where we're kind of surrounded by lasers that you use during practice. There's one therapy called red light therapy. What is your opinion on that? Is that beneficial, or does it have some drawbacks as well?
So that's great to look at. So when we look at just basically the light spectrum, one fun way that I like to teach my students is if you want to look at visible light, so visible light goes from about 400 to 800 nanometers. And the shorter wavelengths of light are the blue light, which are used in some treatments. And so kind of think of blue as violet, and underneath that is ultraviolet. We know a lot of those ultraviolet rays can be harmful. Then on the other end, the long wavelengths of light are red light, so around 800. And then after that is infrared. It turns out that we actually have these chromophores in our own mitochondria called cytochrome C oxidase, where it takes up red light and actually converts it to energy. So there's lots of potential beneficial effects with red light, including reduced inflammation and rejuvenation of our mitochondria. So there's potential treatments that we can have. There's this thing called Arndt-Schultz law. So I'm going to go into being super nerdy here. That's why we're at Stanford.
That's right.
So at very high levels, you actually can kill. And so sometimes we use very, very high, powerful lasers at very high settings to destroy things like blood vessels, or shrink them, for things like rosacea or conditions that cause that, or even with acne or acne scarring. And so at moderate levels we damage, but at very low levels you can actually stimulate. So a lot of these red light treatments that people have are at these low levels that have these sort of biostimulatory effects and can have anti-inflammatory effects.
So when I see on the TV the wands with the red light, the light wands, and you just do this and this and this, is that an oversell in effect?
Yeah, there are thousands of home-based devices out there, and you know the FDA does have a clearance pathway for home devices and light-based devices. So all the devices we see here are what are considered class 4. So those are like the most powerful. They can certainly have damaging effects, like to the eye and of course to our skin. But we as dermatologists and as laser surgeons and experts, like we use specific ways to damage the skin to get the effect that we want. So some of these devices do have what's called an FDA clearance. So these home devices are usually class 2, but there's so many devices out there. I mean, there are even apps for phones. So I would say proceed with caution.
Yeah.
You know, there are so many devices out there.
Especially when they're endorsed by celebrities who look perfect all the time. So you kind of buy into that.
Yes. Yeah, that can be tough. And I think one of the beautiful things about being here on Instagram is we have an opportunity to say that, you know, the number of images, and not even still images, but video images that we're exposed to has exponentially increased.
Yeah.
So nowhere else are we looking at ourselves, right? With Zoom, we're spending our entire meeting looking at images of ourselves, and a lot of patients
And we become more critical.
Exactly, yeah. And then people come in and they're like, I don't like the way I look on Zoom. And I'll say, well, the good news is everyone's just looking at themselves. They're not looking at others. But yeah, we do become more critical. So I think it is important to balance the desire to look our best, which I think is absolutely reasonable, should not be downplayed, with really an unrealistic expectation. So I think, again, proceed with caution.
Mm-hmm. As you look at yourself more in Zooms or in other circumstances, you know, some people may have deep acne scars. So how do you treat that?
So acne scars is also something that I see a lot of, and acne scar is something similar to skin cancer that has different racial and ethnic differences. So we actually do find that Asian patients, African Americans and Hispanics tend to have deeper inflammation, and this is something that's been published in the dermatology literature. And when you have that deeper inflammation, you're more likely to get scarring from your acne. So the first thing is, if you are starting to notice that you have scarring from your acne, I have a really low threshold for treating my patients with a retinoid, an oral retinoid called isotretinoin. You know, that's kind of the only medication that is a cure for acne. Now, there is a national registry for it because it is a very strong medication. It's one that absolutely can cause devastating birth defects, so it should not be taken at all during pregnancy, but is one that can really change the course of acne to prevent that acne scarring.
What about eczema? How do you treat that?
So eczema is an interesting condition. So eczema kind of goes along with that hay fever, allergies, what we call atopy. And it turns out eczema is more common in first world countries because there's something that we love to do, probably a couple times a day, sometimes in the summer, and that is bathe. So as we are really over cleaning and constantly cleaning ourselves, we're reducing the diversity of the microbiome that we have on the surface of our cells, of course in our gut as well. But as we do that and we kind of eliminate and remove the natural oils, our skin can get dry and can get itchy. So I know this is probably going to be blasphemous, but don't shower every day.
Okay.
And it turns out, I know, sometimes people are like, can you give me a letter?
Because you're scrubbing away the natural oils in your skin. That's what I've heard.
Yes, yeah, absolutely. And really, you know, a lot of us who live healthy lives or exercise regularly, we may be perspiring, but it turns out there's just a few parts of our body with these apocrine glands that actually makes smelly sweat. Mm-hmm. And that's in our armpit and in our groin. And so in those areas you can soap up, so you can sort of not soap in the other areas if you do want to shower every day. You know, guilty as charged. And then when you get out of the shower, kind of moisturize your skin. And that's where you can use really bland moisturizers or kind of your favorite over-the-counter moisturizers to use.
Good to know. We also have questions about hyperpigmentation.
Yeah.
How do you treat that?
So hyperpigmentation is basically when we look at our underlying skin color, and we have a lot of diversity in people's skin coloring. But what happens is that there are conditions that, like acne, or any inflammation, like even if people have eczema flares or something like psoriasis, that once they resolve, we can actually be left with pigmentation. We know the sun stimulates our melanocytes, and so that can also cause pigmentation. And this condition called melasma, which is near and dear to my heart, is a condition that I treat often, is actually initially known as the mask of pregnancy, but can happen in men too. And so interestingly, going to ultraviolet light, what happens is ultraviolet light converts vitamin D to its active form, but actually breaks down folic acid, which is really critical in the early phases of pregnancy to develop your spine or neural tube. So we think potentially this pigmentation happens to really protect the woman in early pregnancy from breaking down her folic acid, because it is so essential in the early stages of fetal development. But yeah, once this condition happens, it is a chronic condition. So I tell my patients it's like diabetes or high blood pressure. You're going to have it for many, many years. Yeah. And so we can really treat the symptoms of it, and we have topical treatments, we have different lasers, and we actually even have oral treatments that can really treat melasma or pigmentation.
Okay, here's a question for you. Your skin looks gorgeous. So what's your skincare routine, your personal routine?
I know that there's so many skincare videos out there, and I always love the skincare videos that are like my 10-minute routine, and then it's like a 25-minute video, and I'm thinking, that math doesn't add up. Yeah. So I try to keep it really simple. I'm a busy professional like you, and so I have like a real simple regimen that I have for the morning and the afternoon. We can kind of delve into it deeper if you want, but keep it simple. Keep it under 5 minutes. No one, wants to be like Patrick Bateman. I don't know if any of you guys saw the movie Psycho, but like if you just look up his morning routine, I mean, his routine is, so complex, but it makes sort of a lot of the common routines that we see now look really simplistic. But no, we want a simple regimen that most of us.
So what's your simple regimen before you walk out the door?
So my first is cleansing. So I try to wash my face twice a day. So I have a gentle cleanser that I use. My skin tends to be a little bit oily, so I'll use a foam-based cleanser. But if my skin was dry, I could use a cleanser that's non-foaming. Then I use hyaluronic acid, and I use like a really inexpensive one. I ran out of the one for my face, and I turned out, oh good, something in a pump. So I'll put that on my chest, my neck, and my face. Okay. I feel like my décolletage and my neck or something that I sort of didn't think about until I became a dermatologist. So I'll put that on. Then I have a vitamin C product that I use. Okay. So I'll use that. And in the morning, my third step is sunscreen. So I'll use sun protection.
That's pretty easy. Under 5 minutes?
Under 5 minutes, yeah, absolutely.
And I think I asked you this before. You get the ones from, say, the drugstore,
yes,
or you can get the really pricey ones, at the department stores. Is there much of a difference?
You can get really great products over the counter. So, there are some products that I think are really great. They may smell really good, and if that's something that you want to spend your money on, more power to you. But I don't think that that's necessary. I think it can be accessible to really everyone. So over-the-counter products at the drugstore work just as well.
Okay, so let's wrap this up. What is your one tip, your one piece of advice for healthy skin?
I think my one piece of advice is that true beauty is an inside job. So focus on the things that make you happy, the things that bring you joy and meaning in life, and all of the other stuff is a bonus.
And for skincare, let's wrap this up in terms of, okay, wear your sunscreen. Doesn't matter if it's 70 or 90. I mean, the higher the number, it doesn't necessarily mean you're going to be more protected from the sun.
Yeah,
right?
Absolutely. I wear 50 myself, so yeah.
And then also, start eating more vegetables like broccoli, carrots, and squash for the
there's a whole list of the carotenoids.
Carotenoids.
Beta carotene and others.
And just have a healthy, I guess a healthy view of life too, to take care of that skincare.
Absolutely.
All right. So great advice today on Ask Me Anything Live with Dr. Zakia Rahman, and she is the clinical professor of dermatology here at Stanford Medicine. I'm Lisa Kim. Thanks for joining us today.
Thanks so much, Lisa. Bye, everyone.